Hello and welcome to Healthcare 101, a simple guide to understanding your health insurance. Today we got module 4. We're going to talk about this is understanding your costs. So we're going to hit on a lot of different buzzwords, if you will, and I want to define them and tell them how they impact you in terms of the payments out of your pocket. So first up is premium. Premium is the monthly amount or the per paycheck amount that you're paying to this insurance company so that you have this contractual agreement that at a certain point they pay for all of it or that you have co-pays for certain things. So your premium is your membership to the club. Okay. This is what you're paying to have access to these discounted rates and these co-pays. Deductible. A deductible is what we've talked about earlier. This is the amount that you're going to have to pay 100% of before the insurance company starts to pay. All right. If you have $1,000 deductible and you have a hospital stay, emergency room visit, surgery, whatever it may be, you're likely going to have to pay 100% of that cost up to your deductible. After your deductible, then you start sharing the cost. That's called coinsurance. So coinsurance is when after your deductible, you're paying 20% of the cost and the insurance company is paying 80% of the cost. That's coinsurance. And that goes all the way up until we hit our out-of-pocket maximum, which we talked about in an earlier module. Out-of-pocket max is the most you would spend in the calendar year. That's the maximum amount. Once you hit that number, you pay zero. And then the last number you should know about, or last term you should know about, is a copay. Copays are those flat dollar amounts you're paying for doctor visits, for lab work, for prescription drugs, and those kind of services. Now let's talk about how you read a bill. There's two types of documents that you might get that you might consider a bill. The first document, which is not a bill, is called the explanation of benefits or an EOB. This is the most important document you could get when you're talking about having a medical interaction. This is where the insurance company has received this claim. They see that Dr. Jones charged you $1,000 for this service. They only allow $500 for that service. That's their contractual rate. Of that, you only owe this much because you pay a co-insurance or a copay or whatever it may be. So while that's not a bill, it is very critical to get that and compare it to the medical bill, which is the other kind of bill. This is a real invoice. This is the real bill from the doctor, from the facility, from the hospital saying, we treated you for A, B, C, D, E, F, G. You owe us this much money. You never want to pay this medical bill before you see your EOB. The EOB is going to help you understand if what you're being charged is correct. Regular medical bills have upwards of 50% incorrect rate. Okay, there's mistakes on almost half of all the medical bills out there. So the EOB, compare it to your medical bill. If the numbers match up, pay it and you're good to go. If not, it's time to start looking into that by calling your insurance claims department. Now, the last thing are some tips to save. Number one, use generic drugs. Many of the brand name drugs out there do have generic equivalents. If you're being prescribed a prescription drug by your doctor, ask them, is this a generic? And if it is not, ask them if there would be a generic available that would be just as effective for you. Stay in network. Okay, we talked about you got to go to in-network providers. They have a maximum amount they can charge you. It's all discounted rates negotiated by the insurance company. You're not going to get these big balanced bills later on. So that's very important. And also ask these providers to do a pre-authorization. Anytime you're getting any service, make sure a pre-authorization has been done. Be adamant about it because when there is no pre-authorization, this is when you end up in a scenario where you're sitting in the doctor's office finding out your situation is not covered. You took half the day off of work. You were expecting to do a thing and it's not covered. You can handle all that beforehand with a pre-authorization. Lastly, ask about cash pricing and payment plans. Cash pricing is probably not going to save you money if you've got a health insurance plan in place, but it's always good to find out. If you can pay 50 for something the insurance company wanted you to pay 250 for, that's a win. And then payment plans. Hospitals, providers' offices, they're always willing to break these big chunky payments into a payment plan. So you can always ask if you've got a $2,500 bill that the hospital is asking you to pay, call them up and negotiate a payment plan of $100 a month, $200 a month. You get to kind of make the rules a little bit on that because remember, they want to get paid. So that's going to be helpful for you. Thanks for tuning in to Healthcare 101.